Hospitalisation due to COVID-19 is currently standing at over 3,200 in both public and private hospitals in the province. On average, the province used 12 tonnes a day over the last year and 27 tonnes a day during its first peak in July. Public hospitals are now using more than 48 tonnes of oxygen daily, equating to 70% of the total capacity in the province.
We've been working with Afrox and they've put contingencies in place to bring additional oxygen into the province daily to augment the provincial supplies and now to provide a total capacity of 95 tonnes of oxygen per day. So while we're using 76 tonnes, we actually have access to 95 tonnes. And that is the additional capacity that's been brought in. We now have 5 bulk oxygen tankers allocated to the Western Cape in total to help us to manage that, with regular daily deliveries from the Eastern Cape, from PE, to bring this additional oxygen into our system.
The peak of the second wave is expected in the province this week, with rising active cases in all districts except the Garden Route. The province says more than 25 healthcare workers have also died since the 1st of November, with more than 90 admitted in the last 2 weeks. Over 1,000 healthcare workers are currently infected across 95 institutions.
495 contract appointments are currently in process since the 1st of January across the platform, and 322 new medical interns have been appointed. That replaces old interns, and the military has now confirmed that they will give us additional staff as of today.
While there's been a significant reduction in trauma cases over the past week, COVID hospitalizations are on the rise, with the Worcester drainage area currently under most pressure at 102% capacity. The province says logistics around vaccine supply and distribution is part of its strategy.
I myself am really working hard to find vaccines that we can bring into the system as quickly as possible. And obviously we've got a national approach, but if I could find supply earlier and quicker, then that's exactly what I will do. But then we still have to follow through, as I said, the SAPRA approvals. We've got to make sure that all those are in place. And of course, primarily, it is the delivery of those vaccines to the citizens of this province.
The first 100 of 200 beds at the Lentegeur Field Hospital in Mitchells Plain have meanwhile been opened, with 64 patients already admitted. Vanessa Puna, SABC News, Cape Town.